Hello, I'm Dr. Shashank Jaiswal. I'm a consultant neurologist at Care Hospitals, Banjara Hills. Today, I'd like to talk to you about Alzheimer's disease. Alzheimer's disease is a part of a group of disorders known as dementia. Dementia refers to any brain disorder that affects your memory and your process of thinking. So, not all causes of dementia are related to Alzheimer's disease. There are a lot of treatable causes of dementia, like B12 deficiency, low sodium, sometimes infections, or sometimes a buildup of fluid in the brain, which can all be addressed and the dementia can be reversed. But Alzheimer's is a progressive disease and there is no known cure for it right now. It usually affects people beyond the age of 65, but because of a genetic predisposition, some people can be affected at an earlier age too. So, what are the most common symptoms for Alzheimer's? The most common symptom is memory loss. The patient is unable to form new memories. So, you would find that your loved one who is affected by Alzheimer's is asking the same questions repeatedly. Sometimes gets disoriented and does not know where they are. Sometimes cannot remember trivial things like if they have had breakfast in the morning or if they have even taken their medications. A few patients present with overdose of medications because they cannot remember that if they have taken the medications and sometimes double or triple their doses. As Alzheimer's progresses, it affects the person's ability to think, it affects their judgment. Eventually, it affects their ability to walk. Sometimes it's their ability to eat. Patients also can have sleep disturbances, behavioral changes, and sometimes they can lose bowel and bladder control. So, what can we do to manage this disease? So, once a diagnosis of Alzheimer's is established, there are certain medications that your neurologist can start to delay the progression of the memory disturbance. Apart from this, the family needs a lot of counseling because they are the primary caregivers for this patient. To avoid mishaps like soiling themselves or wetting themselves, timely visits to the bathroom and also adhering to a good routine will help these patients to cause any further embarrassment. So, apart from the management of Alzheimer's, we can also sometimes prevent or delay the onset of Alzheimer's by controlling your comorbidities like diabetes, hypertension, avoiding head trauma, keeping yourself mentally active can all help prolong or delay the onset of Alzheimer's. So, what can caregivers do to help the patient who is suffering from Alzheimer's? A good routine, maintaining the patient's daily life in a familiar environment can help this patient maintain orientation and prevent confusion in these patients. We also advise that these patients avoid sleeping during the day as much as possible so they have better sleep at night. Let the patient receive sunlight throughout the day so that they are well oriented to the day and night cycles. Do not let these people wander out of the house without any supervision because sometimes they can lose their way and wander away. So, if you or any of your family members are facing the symptoms that I have mentioned, please consult your local neurologist or come on down and we will evaluate you for what might be affecting you. Not all causes of memory loss are Alzheimer's and many of them are treatable. So, wishing you a healthy, happy life.